Ready? Are you filming? Hi everybody, it's Kara Thomas again. I'm doing Lab 4 video that includes respirations, cardiac assessment, and safety fall risk. Alright, so the first thing I'm going to do before I go to the patient, I'm going to check the doctor's orders. And what I just stated is on the doctor's order. So I'm going to go come in, I'm going to practice hand hygiene and provide privacy. Alright, hi patient.
Alright.
Do you mind to please verify your name and date of birth?
Brian Douglas Reed, date of birth is 3/9/87.
Alright, then I'm going to check to verify the patient's wristband. See if they say they are. And I'm here to do your respiratory, your lung sounds, and your cardiac assessment and educate you on safety and fall risk. Is that okay?
Yeah, that's fine.
All right. So what I'm going to go ahead and do is I'm going to do their pulse and assess their respirations as I check their pulse. I'm going to do that for 30 seconds. So I did get 50 for your right brachial pulse. Okay, and as far as the respirations, I did count 10. Did you do any activity recently?
Yes, I just got done on the walk.
You walked, okay, how long did you walk, did you say?
Approximately.
Like how many minutes or distance?
About a mile.
Okay, a mile. So that would explain the 50 times 2, so that's 100 first pulse, and his respirations being 20, and they work quick. Alright, so next thing I'm going to do is I'm going to go ahead and I'm going to listen. Check, make sure. Outward. And I'm going to check 4 anterior, 4 posterior, and 2 lateral. All right. Just go clear. If you can, take a deep breath. Take a deep breath. That's good. Take a deep breath. Alright, and if you don't mind moving forward, here, take a deep breath. Take a deep breath. And let me know any time if this is bothering you. I'm going to go straight down. Come over here, see what I'm doing in the back. Take a deep breath. And the fourth one, breath. And then I'm going to come over to the side. Sorry, take a deep breath. And then lift your arm up now. Take a deep breath. Alright. Break that down. So lung sounded clear. Alright, so since I already, okay, next what I'm going to do is I'm going to check for what's called a JEV to see if this has any distension. And I'm looking to see, and I don't see that. I don't see that on either side. So next what I'm going to do is I'm going to check the carotid pulse. Like right in that notch. 30 seconds. check the other side. That's your head, sorry. Alright, starting now, I'm going to go for 30 seconds. Okay, it went down that time, I think it on both sides, so that's 80. Okay, and then what I'm going to do, since I already checked the right brachial post, I'm going to go ahead and I'm going to check this other post. Start at the line. Okay, so I got 49. So pretty much the same as the other post. That was the left. Okay. Now what I'm going to do is I'm going to go ahead I'm going to assess your capillary refill. We're just checking to see how quickly the blood comes back. Alright, so that's 3 seconds. I'm going to do the same with your skin. Alright, so that's good. Alright. Okay. So the next thing we'll do is feel your skin temperature. Feels normal. Okay. And I'm going to check for any edema or swelling. Alright, and then now I'm going to check your femoral pulse. That's right here. Hands. I'm going to have you go the leg. Okay, I'm going to do behind the knee. Alright, and this is the posterior tibialis. Alright, now I'm going to do the other knee. Behind the other knee, sorry, okay? Alright, now what I'm going to do is I'm going to auscultate the cardiac sounds. You have any chest pains? All right, so where I'm going to start at is the, I apologize, the aortic here. That. And we're going to come down over to the pulmonary. And the Erb's point. And then to the mitral. Which where I'm going to listen for a minute. Okay, and I did get 94 beats, so just pretty much the same as the pulses. Okay, and let's see if there was anything else that I do here. Physical assessment. All right, so the last thing I'm going to educate you on is on safety. Safety around your house, like show that removing the trash. Any type of fall risk like animals, making sure you don't have any wires laying around. That's pretty much it. In the bathroom, making sure you have things that don't potentially make you fall or slip. I don't really see too much, but just be practicing safety along with, not being able to trip on stuff, just being more cautious, and, with hygiene and everything else. Did you have any questions?
No, ma'am.
All right, are you experiencing any pain?
No, ma'am.
No pain?
No, ma'am.
All right, well, thank you, and as I leave, I'll practice hand hygiene, take my stuff, I'll provide privacy, and the skill's complete.